I thought I would share with you some of my tips for the anatomy stations. So the anatomy stations generally consist of a diagram that you'd need to label, and then a few follow-up questions after that. There's a few regular topics that often come up in the anatomy stations that I would say you should definitely have a look at before the exam. So these include the antecubital fossa, the brachial plexus, the orbital foramina, muscles of the eye, the diaphragm, the cross-section of the neck, the course of the trigeminal nerve, intercostal nerves, spinal tracts, the larynx, the sacrum, and the base of the skull. So that sounds like quite a lot, but if you have a look at all those things and you're comfortable with them, that's most of the work for the anatomy stations done. In terms of the follow-up questions, it's worth having a think about when you're going through those topics about typical questions that could come up. So, for example, with the sacrum, they may ask about the sacral canal contents, and they may ask about a caudal block and local anaesthetic dosing, for example. With spinal tracts, they may ask about the role of the different tracts. They may ask about what would happen in the case of hemisection of the spinal cord or anterior cord syndrome, for example. Coming up are a few videos of some of the different anatomy topics, which I hope you find useful.